Today everyone, we are going to discuss about the health education curriculum. So, health education from kindergarten to grade 10 focuses on the physical, mental, emotional as well as social and spiritual dimension of holistic health. It enables the learners to acquire essential knowledge, attitude, and skills that are necessary to promote good health and to prevent and control diseases, to prevent substance misuse and abuse, and to reduce health-related risk behavior, and to prevent and control injuries with the end view of maintaining and improving personal, family, communities, and global health. Health education emphasizes the development of positive health attitude and relevant skills in order to achieve a good quality of living. The focus of skills development explicitly demonstrated in the primary grade level. Meanwhile, a comprehensive body of knowledge is provided in the upper year level that serve as a foundation in developing desirable positive health attitude, habit, and practices. Health content areas: injury prevention, safety, and first aid discusses the cause and prevention of accident and injuries while performing various of activities at home, in school, or in the community. So, prevention can be done through promotion of safety environment. Community and environmental health situates the learner as an integral part of community and environment, with the great responsibility of protecting the environment with the support of individual and community actions and legislations promoting a standard health, hygiene and safety in food and water supply, waste management, pollution control, pest control, and as well as the delivery of primary health care. So next is consumer health. It focuses on the application of consumer knowledge and skills in the effective evaluation, selection, and use of health information, products, and services. So next is family health. Covers information on human life cycles and also in family dynamic that influence an individual's development of ideals, values, and standard of behavior with regards to sexuality and responsible of parenthood. So next is growth and development. So it emphasizes the developmental milestone and health concern during puberty and adolescence with focus on personal health and development of self-management skills to cope with life changes. So next is nutrition. Nutrition addresses the importance of eating healthy and establishing a good eating habit, especially for children and adolescents, as a way to enhance and prevent diseases. So in personal health, comprises personal health habits and practices that promotes physical, mental, social, emotional, and moral spiritual health and prevent or manage personal health issues and concern. So next is prevention and control of diseases and disorders. So it involves the prevention and control of both communicable and non-communicable diseases and disorders through the development of healthy habits and practices and the adoptions of health program supported by legislation with provision on school and community health services. So this is the last part of health content areas, which is substance use and abuse. So in this part, it highlights the prevention and control of use, misuse, and abuse of the substance and drugs by providing comprehensive information.
Good day, everyone. Let me present to you the 9 characteristics of the health curriculum. First is the culture responsives. Uses the cultural knowledge, prior experiences, and performance styles of the diverse student body to make learning more appropriate and effective for them. according to Gay 2000. Second is the epidemiological, relates to the incidence, prevalence, and distribution of diseases in population, including detection of the sources and causes of epidemics. For the third one, health and life skills base, applies life skills to specific health choices and behavior. Next is the holistic, analysis the interrelationship among the factors that influence the health status, the areas of health, and the dimension of health, including physical, mental, social, emotional, moral, and spiritual. For the number 5, learner-centered, focuses on the student's needs, abilities, interests, and learning style with the teacher as a facilitator of learning. For the number 6, preventive, characterize something that helps people take positive health action in order to prevent diseases and to achieve optimum health. Next is the rights-based, advance the understanding and recognition of human rights as laid down in the Universal Declaration of Human Rights and other international human rights instruments. For the number 8, standards and outcomes-based, requires students to demonstrate that they have learned the academic standards set on specific content and competencies. And for the last characteristic is the values-based, promotes an educational philosophy based on valuing self, others, and the environment through the consideration of ethical values as the basis of good educational practice.
This is the first quarter in grade 5 under the health curriculum. First is the mental, emotional, and social health. Number 1, characteristics of a healthy person. Mentally, emotionally, and socially. Yan, kailangan nasa characteristics ng isang healthy person about sa mental natin, emotion, and pakipag-socialize sa ibang tao. Next, ways to develop and nurture one's mental health. Yan yung pag-develop natin sa mental health natin. Next, ways to stay emotionally healthy. Yan yung kahit, example, meron tayong mga problema, ganon, pinagdadaanan. Dapat napapanatili pa din natin yung positive side. Next, healthy and unhealthy relationships. Sign of healthy relationships. Loving, finally, genuine, and friendships. Yan, yung friendships sa may pagkakaibigan. Makikita natin doon kung healthy yung relationship natin sa kanila kapag maganda yung pakikitungo natin sa kanila at maganda yung pakikitungo nila sa atin. Next, importance of healthy relationships in maintaining health. Yan, kagaya nga ng sinabi ko. Next, number 3. Signs of unhealthy relationships. Makikita din natin yan yun. Tapos next is managing unhealthy relationships. Example nga yung sinasabi natin na toxic, yung nasa paligid natin. Dapat kaya natin yung i-handle. Next, mental and social health concerns. Include ways on how this negatively impact one's health well-being. Yan yung social anxiety. Example, yung mga nakakasama nga natin, nakakaranas tayo ng anxiety, mas lumalala pa. Next, mood swings. Yan, yung pabago-bago nga ng mood. Next is testing. Yan. Number 4 is bullying, including cyberbullying. Ayan, yung pagiging bully natin or pagiging bully ng iba sa atin. Nakakaranas din ito ng unhealthy sa sarili natin. Next is harassment. Ayan, yung pangharas. Gaya ng pamimisit man lang ba, ganun. Next, emotional and physical abuse. Ayan, naka-include dyan yung bullying saka harassment. Tapos 7 yung other stressful situations. Ayan, example, yung mga requirements na yan kung late na natin nagagawa o na isasubmit at hindi rin natin alam kung ano yung kailangan natin gawin.
So in letter D, so preventing and managing mental, emotional, and social health concerns. So first is number 1 dito is yung practicing life skills. So dito is nakapaloob na yung communication or pakipag-communicate mo, assertiveness, self-management, and decision making. And last is yung finding resources and seeking help. So in grade 5, growth and development, personal health in second quarter. So first is changes during puberty, or dito is yung pag yung pagdadalaga o pagbibinata ng isang tao. So physical changes. So ito yung mga nangyayari o yung mga pagbabago. So secondary is sexual characteristics such as hair growth, voice change, breast development, and menstruation. So dito daw is pumapasok na yung pag-iiba ng iyong boses, yung paghaba ng buhok mo, and yung paglaki ng dibdib lalo na sa mga babae, at yung menstruation. So next is number 2 naman is nakapaloob din dito sa content na ito is yung emotional and social changes. So dito is nag-iiba na yung emotion mo, and yung social changes nga yung pakikitungo mo sa iba or yung pakikipag-usap mo minsan. Kasi nga is lumalaki na tayo or nagmamature na tayo, kaya siguro is nag-iiba na emotion natin minsan, and yung nag-iiba na rin yung pakikitungo natin sa iba or yung social changes. So next is in letter B naman is yung puberty related health myths and misconceptions. So dito is number 1 is pumapasok na nga dito yung on menstruation. So para to sa mga babae. So dito daw is not taking a bath, so hindi maliligo, not carrying heavy load, so bawal sila magbuhat, avoiding sour and salty food, so bawal sa kanila yung mga alat na pagkain, no physical activity, so bawal din sa kanila mga physical activities, yung mga volleyball, ganun, yung mga larong basta physical activities. So use or menart for facial wash. So number 2 is on nocturnal emissions. So dito is not related to is yung preoccupation with sexual 2, and on circumcisions at the appropriate maturational stage. So ito lang yung content sa A and B.
And this is the letter C content in grade 5 curriculum. Puberty-related health issues and concern. Then number 1, nutritional issues. Number 2, mood swings. 3, body odor. 4, oral health concerns. 5, pimples or acne. And then 6, poor posture. Then 7, menstruation-related concerns, premenstrual syndrome. So for the content, we don't have content, and then let's move on the learning competency. 5, describe the common health issues and concern during puberty, and then accept the most of these concerns are normal consequences of the bodily changes during puberty, but one can learn to manage them. So the learning materials is OHSP Health 1, Question 1, Module 2, Reading 2, and then etc. Then let's move on to dysmenorrhea and other abnormal conditions. So early and unwanted pregnancy. And then number 9, sexual harassment. So learning competency, demonstrate empathy for persons undergoing these concerns and problems. And then 8, discuss the negative health impact and ways of preventing major issues such as early and unwanted pregnancy. For the last part is letter E, sex and gender. Number 1, sex, male, female, or intersex. 2, gender identity, girl, woman, boy, man, or transgender. Number 3, gender roles, masculine, feminine, and then androgynous. And then number 4, factors that influence gender identity and gender roles. The learning competency, 12, differentiate sex from gender. Number 13, identifies factors that influence gender identity and gender roles. And 14, discusses how family, media, religion, school, and society in general reinforce gender roles. So 15, give example of how male and female gender roles are changing. And then the learning materials is edukasyon, pangkatawan, kalusugan, at musika. And edukasyon, pangkatawan, kalusugan, musika, and etc. And that's all. Thank you.
Good day, I'm Sharmina Ganad. In this curriculum of Grade 5 Substance Use and Abuse for the third quarter, these are the objectives for this lesson After the lesson, the learners able to explain the concepts of gateway drugs, identifies products with caffeine, discusses the nature of caffeine, nicotine, and alcohol use and abuse, describes the general effects of the use and abuse of caffeine, demonstrate life skills in keeping healthy through the non-use of gateway drugs, and lastly, follow school policies and national laws related to the sale and use of tobacco and alcohol. First is the nature gateway drugs. From itself, nature it means it is the start. The nature gateway drugs, when we talk about drugs, it is not always about cocaine that we always knew, and it has many kinds of it. Sometimes it is legal but it turns into illegal if it is used every day. First is the caffeine. The products that contains caffeine such as coffee, tea, and cola drinks. It is all legal because we intake it through drinking and it is used for some reasons, and we didn't know that every intake of caffeine there will be a result. Second is the tobacco. When one tobacco or cigarettes can relieve stress sometimes, and when people get the taste of it makes them feel good, and we all know it is legal, so we have the chance to buy again until we don't like it. And next is alcohol. It is legal throughout the world, and so that's why it is easily accessible to all stores who sell alcoholic drink. So everyone has the privilege to buy, and it starts the fact that everyone will immerse themselves to alcohol. Next, letter B, effects of gateway drugs. In caffeine, the common effect of it is getting your heart beat faster than normal beat. And sometimes it causes good effect to the brain, like always getting alert, but sometimes it can affect your brain like how you think. Example, you think you can think properly because of an headache. It is good to intake caffeine, but it depends on how you will lessen the usage of it before it turns into addiction. So it is the reason why some people palpitating because of the caffeine. Next is the tobacco. The first thing that comes to our mind when we hear tobacco is smoke and cancer. Yes, these are the common effect of it, especially to the lungs of the user. The user use only one cigarette, but because of the nicotine that make them attract or addict to it, day by day they buy a one pack of cigarettes, so it turns in addiction, and their teeth also lost because of the cigarettes. And for the alcohol, is the common drink for some people who have a problem because they believe it will lessen their problem. So it turns again into addiction. And because of the addiction, their kidney will affect and can pee easily. The brain will also affected by the way we think. We can focus on the things we do because of the alcohol. If they consume at least 5 to 6 bottles every day, it can lead to death if they haven't eaten before they drink. Next part, impact of the use and abuse of gateway drugs. An individual, for the common impact of it is they don't get enough sleep, and it can lead into serious illness because of drug abuse. They will suffer of mental illness like trouble in thinking right. Your life can turn into a miserable because you always use drugs. And for family, when one of the member in family is in the world of addiction or drugs, it will be the reason of separation of the parents, so the children will suffer to it. And as they grow up, they are traumatized with the behavior they experience on their father. So they will repeat it in the next few years. It will let them also to be aggressive in every step they make because of the moves they see on their father that are aggressively holding their mother because their father used drugs. And for the community, when the individual turns into addiction, not only themselves will be affected but also the people surrounds them. Like if they can think properly and they don't know what they are doing, they can do a crime with the presence of alcohol. They will give a problem to society because of their behavior when they are intoxicated with alcohol. For the last part of this quarter, prevention and control use and abuse of gateway drugs. Development of life skills. First is the resistance. It is the way we do some things to avoid traits we actually do in our health. So, we need to avoid all the gateway drugs and do some leisure activities that will help you forget to use drugs, and also there are many activities will help you to avoid it. For decision making, it is the ability to decide what is good for your health, and it can be the best decision to make, like bonding with your family instead drinking alcohol and sipping cigarettes. And exercise your body to make your body healthy and fit. For the communication, communicating to the other people that maybe can help you, and this can be the benefit of it, like you will be having a good day talking to the other people and tend to forget on using any drugs, and they will give you advice on choosing or avoid the gateway drugs. For the second, observance of policies and laws such as school policies and national laws, Republic Act 9211 or the Tobacco Regulation Act of 2003. RA 9211 said it is an omnibus law regulating smoking in public places, tobacco advertising, promotion and sponsorship, and sales restriction. So the purpose of this law is to help everyone not to be affected to the smoke of tobacco, so they implement this for them not to use cigarettes in public areas. We all have the authority or privilege to use cigarettes, but always observe the people that surrounds you. Maybe meron pala silang hika and they smell the smoke, and it can lead into a major illness to them. So, in this quarter, I discusses all the effects of gateway drugs not only for the users but also to the people na nasa paligid nila, and if someone you know na umiinom na ninigarilyo or addict sa kape, pagsabihan mo sila na if it turns into addiction, it can cause an illness to them or they can kill themselves just consuming gateway drugs. Gaya nga ng sinabi ko, yung gateway drugs is hindi naman siya ganun ka sama. And nagiging masama lang yung epekto nito kung may naapektuhan ka ng ibang tao, like your family and yung mga taong nasa paligid mo. And before use gateway drugs, dapat hindi mo sasanayin yung sarili mo na gumagamit ng mga legal drugs like alcohol or cigarettes. Kasi pag habang tumatagal, mas maa-addict ka and hindi mo na kayang iwasan yung mga bagay na yon. So, bago ka dumating sa part na yon or sa point na yon, dapat may mga nakahanda ka ng solusyon or yung mga bagay na dapat makakapagpaiwas sa'yo sa paggamit ng alcohol or pagsigarilyo. Like, madami namang bagay. Halimbawa, magbabike ka, exercise, para maiwasan mo yung mga bisyo na nandyan lang sa paligid.
Good day everyone, my name is Mariel H. Combis, your teacher for today, and I will be discussing injury, safety, and first aid. But first, let us define what is injury, safety, and first aid. An injury is a damage to your body. It is a general term that refers to harm caused by falls, hit, weapons, or any accident. Ito yung kapag nasugatan tayo, na-aksidente tayo sa motor, sa sasakyan, ito yung mga natatamo natin. Halimbawa, sugat, gasgas. Next is safety. Safety is the state of being safe, the condition of being protected from harm or any danger. So from the word itself, safe, which means ligtas sa kahit na anong kapahamakan. Next is first aid. It is an emergency care given immediately to an injured person. So in Tagalog, ito yung tinatawag nating paunang lunas. At sobra itong mahalaga, especially when there is an accident or emergency. So moving on to the nature and objective of first aid, number 1 is, it can prolong life. How is it even possible? Siyempre, with the help of first aid, napapabuti natin kahit papaano yung kalagayan ng isang injured person. And then next is alleviate suffering or lessen the pain. So sa paglalapat ng paunang lunas, na-ensure natin na hindi na lalala yung injury. And with that, nalilesen natin yung pain na nararamdaman ng patient. Let's say napilay bago ito idala sa ospital. Nalapatan na natin ng paunang lunas, so hindi na masyadong magiging painful para sa patient yung injury na natamo niya. So let me show a short video clip.
Emergency medical services. Suportahan o hawakan ang joints na nakapaligid sa suspected fracture area. Napakahalaga ng immobilization sa tiyempong ito upang hindi madagdagan ang injury ng pasyente. Kung ang fracture area ay sa braso, lagyan ng splint o kahit na anong tuwid at matigas na bagay na susuporta sa braso. At gamit ang malinis na tela, lagyan ng tali ang magkabilang bahagi. At pagkatapos ay lagyan ng sling at swat upang ito ay ma-immobilize.
So, as you can see, mayroon ng support yung arm niya na may pilay, hindi na niya masyadong may gagalaw. Next is prevent further injury. So, sa paglalapat ng first aid, maiiwasan natin yung na lumala pa yung injury. Halimbawa, sa isang sugat is mapipigilan natin yung pagdurugo and maiiwasan natin yung possibilities na magkaroon ng infection. So, next is we have the first aid principles. Ano-ano nga ba yung principles sa first aid? First is to ensure that it is safe to intervene. Next is first aiders safety first. Kasi as a first aider, kailangan mong maging safe. Kasi paano ka nga makakapaglapat ng paunang lunas sa isang injured person kung ikaw na first aider is na-injured din dahil lang sa nag-intervene ka dun sa situation na hindi pa pala safe. So, next is conduct initial assessment. Bakit kailangan natin mag-conduct ng initial assessment? Para ma-assess natin yung situation, kung pwede na bang maglapat ng paunang lunas, kung ano bang paunang lunas yung dapat nating ilapat, and then, take immediate action. Ito na nga, as a first aider, kailangan is mabilis tayo, maagap, at alam natin kung anong ginagawa natin. And then next is first thing first. Kung sino na dapat yung nauna natin ginagamot, is mag-focus tayo doon. Hindi pwedeng palipat-lipat tayo, hindi pwedeng natataranta tayo. And then get help. When we say get help, get medical help. Ano nga ba yung maaring basic first aid for common injuries and condition like wound, nosebleed, insect bite, animal bite, burn and scald, food poisoning, fainting, musculoskeletal injury like sprain, strain, muscle cramps, dislocation, and fracture. Now, let us discuss what basic first aid na pwede nating i-apply sa wound. Unang-una is wash your hand. It will help avoid the infection. Next is stop the bleeding. Yung mga minor cuts usually stop bleedings on their own. So, kung matindi yung pagdurugo, apply gentle pressure with a bandage or cloth, then elevate the wound until stop bleeding. Next is clean the wound. Rinse the wound with water. Much better kung ito ay running water kasi mababawasan nito yung risk ng pagkakaroon ng infection. Next is apply antibiotic, petroleum, or ointment. Makikip ng ointment or makikip nito yung surface ng balat natin, may iwasan yung magkaroon ng scar or mamomoist nito yung balat natin. Next is cover the wound. Kailangan natin i-cover yung wound or takpan, lagyan ng gasa to keep it clean. Change the dressing. So, do this once a day or at least when the bandage is wet or dirty. Get tetanus shot. Kailangan lang naman ng tetanus shot is if the wound is deep and dirty or kung yung reason ng pagkakaroon natin ng wound is nakatapak tayo ng pako, nasugatan tayo sa mga bakal. And watch for sign of infection so that you'll know if you need to seek for a medical help. Next is we have nose bleeding. Sit upright and lean forward. So by remaining sitting upright, you reduce the blood pressure in the veins of your nose. Sitting forward helps you avoid swallowing blood, which can irritate your stomach. Next is gently blow on your nose. Blow gently on your nose to clear your nose from blood clot. Kasi maaari yun humarang dun sa ilong natin yung pag namuuna yung dugo. And then pinch your nose. Breathe through your mouth and pinch your nostrils. Shut. Pinching sends pressure to bleeding point on the nasal septum and often stops the flow of the blood. Syempre kapag pinipisil natin yung ilong natin dun sa soft na part, nakakatulong ito para huminto yung patuloy na pagdurugo ng ilong natin. Next is insect bite. Move to safer area to avoid more bites. Kasi merong mga insect na once na nakagat ka is nangahabol pa. Kagaya ng mga bee. So, if needed, remove the stinger. Kasi, minsan, yung mga, kapag nakakagat tayo ng mga insect, merong naiiwan na kulay black. Ito yung mga needle nila. Then, wash the area with soap and water. Apply cold compress. So, this will help to reduce pain and swelling. Next, we have animal bite. Unang-una dapat natin gawin is wash the wound thoroughly with soap and water. Much better kung running water. And apply antibiotic cream or ointment and cover the bite with a clean bandage. Pero kapag nakagat tayo ng, let's say for example, ng aso, lalo na yung aso na pakalat-kalat lang dyan, mas mabuti is dalhin na natin sa ospital at magpaturok tayo ng anti-rabies. Next is burn and scald. Unang-una is cool the burn. Paano ba? Itapat agad or hugasan agad sa running water for 20 minutes. Then, remove the tight items from the burn area. O, kung mayroong, let's say for example, yung wrist mo yung nasunog or napasok, tanggalin mo yung mga accessories kasi maaaring ma-irritate pa yung skin mo, matatamaan pa yung part na nasunog, makakadagdag pa siya sa damage nung skin mo. Next is, don't break blisters. Kung napapansin nyo kapag napapaso tayo, may lumulobo, dapat wag natin itong puputokin. So, apply lotion or ointment. Bakit ba? Kasi makakatulong yung ointment or yung lotion na malesen yung pain and mamamoisturize yung parte na napaso. And then, bandage the burn. Pero kung iba-bandage natin yung part ng skin natin na nasunog, kailangan maluwag lang, hindi yung sobrang higpit. Iba-bandage lang natin siya para maiwasan na marumihan or masagi-sagi. Moving on to food poisoning. Unang-una, ang gagawin dapat natin kung tayo ay na food poison, drink water or oral rehydrating solution. Ano nga ba yung oral rehydrating solution? Pwede kang gumawa ng home remedies na tubig, lalagyan mo ng asukal and konting salt. Next is hot compress. Ilalagay natin kung patuloy pa rin tayo sa pagsusuka or nag-stop na yung pagsusuka natin pero masama pa rin yung tiyan natin, gumawa tayo ng i-hot compress natin and ilagay natin sa tiyan natin. Next is let the patient rest. Another one is call emergency hotlines. Dito na papasok yung call emergency hotlines kapag hindi pa talaga maayos yung lagay ng patient. Next is painting. Unang-una dapat gawin kapag nakakita tayo ng nahimatay na tao is help the person lie down. Next is elevate the person's feet. Remove or loosen the clothes, then cool the person. Karaniwang ginagawa ito kapag nahimatay dahil sa init, na high blood, ganon. And then, check vital signs and perform CPR if needed. Assess the persons for any potential injuries. Kasi maaring nagkaroon sila ng injuries kasi mostly ang nag-faint is mga nakatayo. So maaring nagkaroon sila ng injuries dahil sa pagbagsak nila. Call an emergency if the person has not regained consciousness. Last is, we have the musculoskeletal injuries. When we say musculoskeletal injuries, ito yung example nito is yung sprain, strain, na-dislocate or na-fracture yung ankle natin or yung wrist. Ang best way is to perform RICE. What is RICE? RICE is rest. Rest is important for both relief and healing. And then ICE, apply cold compress. It will help reduce pain and reduce swelling. Next is compress. Bandage the injured part if it is your wrist or ankle para hindi na natin nagagalaw yung na-sprain or na-strain na part. So, makakatulong ito para hindi na lumala. And next is elevate. Makakatulong ito para ma-reduce yung or makontrol yung pamamaga.
Good day everyone, I'm Junish April from Mipet 3D. So for today's lesson, we're going to discuss about the personal health issues and concern. So we have the height and weight, vision, ears, skin, posture and spine, and last is the oral and dental. But first, let's talk about the height and weight. So we have the stunted growth, underweight, overweight, and obesity. So let's start. Stunted growth. This refers to the reduce of growth and development of the body parts and skills associated with the certain parts. So it means na yung isang tao is tumitigil na yung paglaki niya o humihinto na yung paglaki niya because of lack of nutrition, or it's either because of sa genes ng mga family natin or ng parents natin. So next is underweight. It is a term of describing a person whose body is considered too low to be healthy. So ibig sabihin, ito yung mga tao na kulang sila sa nutrition and hindi nila na-achieve yung tamang weight nila para sa age nila. And because of underweight is sa school, sa bawat schools is nakaka-receive sila ng feeding program para matulungan sila mag-gain or ma-achieve yung proper weight nila para sa age nila. So next is overweight. The body does not meet the recommended weight based on the height, body weight, and gender by having greater mass than what is considered normal. So meron tayong tinatawag na BMI, which is dun titignan kung angkop pa ba yung weight mo and height mo sa age mo ngayon. And itong overweight is kabaliktaran ng underweight. Kung ang underweight is kulang sila sa timbang, ito namang overweight is lumagpas yung timbang nila sa normal na timbang ng isang tao. So last in height and weight concern issues, we have the obesity. Obesity is extremely overweight with too much accumulation of fats in the body, which shows negative effect on the person. So ibig sabihin, itong obesity nito is sobra-sobra na yung body fats niya sa katawan niya na nagre-result ng negative effect, which is nakakakuha siya ng mga sakit because of her conditions. Isa na rin dyan na sa mga sakit is sakit sa puso and high blood. So next in personal health issues and concern, we have the vision's problem. So we have the astigmatism, myopia, hyperopia, xerophthalmia, and strabismus. Astigmatism is the type of refractive error in which the eye does not focus light evenly in retina. This is the condition in which a person experiences blurry and distorted vision. So aside from changes in vision, sa astigma nakakaramdam tayo ng pagkasakit ng ulo at pagkahilo. So next is myopia. It is also known as nearsightedness. Myopia is a condition of the eye where light focuses in front of instead of on the retina. So, ito yung nakikita mo siya na malapitan, pero pag malayo na isang object or isang bagay, hindi mo siya makikita ng maayos or blurry na siya or yung vision mo is distorted na. So, next is hyperopia, which is kabaliktaran ng myopia. Hyperopia is also known as farsightedness. So, a person who experience hyperopia has a difficulty seeing or focusing on a nearby objects. So next is xerophthalmia, a medical condition in which the eye fails to produce tears. So itong condition na to is yung mata ng isang tao is hindi lumuluha o hindi siya nakapag-produce ng tears, which is may be caused by a vitamins A deficiency. So next is strabismus. It's also known as cross eyes. It is a condition in which the eye do not properly align with each other when looking at an object. So ito yung tinatawag natin na duling. So next in vision problem, we have the hearing problems, which is impacted cerumen, swimming ears, and otitis media. Impacted cerumen, which is the old earwax is moved through the ear canal, which is nagkakos siya ng mahinang pandinig natin or ang tendency hindi tayo nakakarinig ng maayos because of impacted cerumen. So next is swimmer's ear, an inflammation of the ear canal. It often present with ears pain, swelling of the ear canal, and occasionally decreased hearing. So the last in ear problems, we have the otitis media. It is a group of inflammatory diseases of the middle ear. So next in ear problems, we have the oral dental problems. We have the cavities, gingivitis, halitosis, periodontitis, and malocclusions. So first we have the cavities. Cavities are the damages to the structure of the tooth. Second, the gingivitis. The gums become tender, red, swollen, and start to bleed. But it can be prevented with good oral and hygiene. So next is halitosis, also known as bad breath. It is a symptoms in which a unpleasant odor is present on the breath of a person. So next is periodontitis, also known as a gum disease, a set of inflammatory disease affecting the tissue surrounding the teeth. So last in oral and dental problems, we have the malocclusion, a misalignment between the teeth of the two dental teeth, which is the upper and the lower parts. So ito yung condition ng ipin natin, which is hindi sila pantay nung nasa taas at nasa baba. So next in personal health issues and concern, we have the skin, hair, and nail disorders. So first is we have the sunburn. It refers to the prolonged exposure to the sun that causes damages to the skin, which is pag isang tao is nagtagal sa sikat ng araw is nagkakaroon tayo ng tendency o cause na magkakaroon ng sunburn, and madalas itong mangyari during the summer, which is mainit yung panahon. So next is dandruff. It is marked by shedding of dead skin cells from the scalp. So sometimes is makati siya and nagkakos siya ng uncomfortable sa isang tao. So next is corns and calluses. These are hard, raw, and thickened layers of skin that develop because of constant and repeated pressure or friction. So karaniwan natin makikita yung corns and calluses is sa paa and kamay. So next is ingrown and toenails. This nail pierces the skin, which causes the skin to be red and tender and eventually become swollen and painful. This happens when the sides of the toenail grows through the soft skin surrounding it. So next is blisters, small bubbles on the skin filled with serum and caused by friction and burning and etc. So yung blisters is karaniwan siya makikita sa paa or sa kamay na ay yung balat natin is lumulabo na parang may tubig. So next, in personal health issues and concern, we have the posture and spine disorders. So we have scoliosis. It is a medical condition in which a person's spine has a sideways curves. So yung isang tao is hindi normal yung alignment ng spinal cords niya, which is nagkakaroon yung isang tao ng sideways curves na tinatawag na scoliosis. So next is lordosis, or what we call sway back. It is a backward curvature of the lower spine. So next is kyphosis. It is the abnormal outward curvings of the spine that creates a hump-like shape on the person's back. O ito yung tinatawag natin na nakukuba yung isang tao. So next is prevention and management of personal health issues and concern. Number 1, developing self-management skill. So self-management skills are essential in the development of an individual. It helps them to become responsible as a person. So under the self-management skills, we have the good nutrition, which is you need to learn to eat a variety of food, especially in the food pyramid. Kasi lahat na nakalagay sa food pyramid na pagkain is nakakatulong sa ating pangangatawan upang tayo ay maging healthy and fit. So next is proper hygiene. One of the way to maintain health and preventing illness. So to make yourself clean, number 1, make it a habit to wash your hand before and after eating. Number 2, take a bath every day. Number 3, make your hair trim and never share your brush and comb that can cause outbreak of head lice. Number 4, brush your teeth to avoid tooth decay. Number 5, wear a clean socks, underwear, and clothes to avoid fungi. So next is regular physical activity. Exercise is an activity that requires physical effort in order to maintain and improve our health. So next is good posture. What is posture? So posture is a position of a person's body while sitting and standing. So maintaining a good posture will keep your body aligned and can help you to prevent common problems like back pain and neck pain. So next is enough rest and sleep. So having a proper sleep will help you to feel better and to keep your heart healthy.
Good day everyone, I am Justin D. Gatle from BPED 3D. Today I will discuss K-12 Basic Curriculum Grade 6 Community Health. Keeping homes and schools and communities healthy through proper waste management. How is this important? Mahalaga ito dahil mas makakatulong tayo sa komunidad at sa ating mga sarili para mapanatiling ligtas yung nilalanghap nating oxygen or yung hangin na nakukuha natin sa paligid. And then, mas magiging ligtas pa tayo at magiging prone tayo, mas healthy pa tayo and makakaiwas tayo sa mga sakit na pwedeng dumapo sa atin kung malinis yung kapaligiran. Unang-una ay biodegradable. Ano nga ba ang biodegradable? Biodegradable is an object or substance that capable of being decomposed by bacteria or other living things. Biodegradable, ito yung pwede mo siyang sunugin or pwede mo rin siya i-recycle. And then, yung iba naman is natural na nade-decompose by the nature. For example, paper. Yung mga papel or yung paper is kaya nating masunog o kayang masunog natural way or kahit tayo yung gumawa. Pwede rin siyang i-recycle at gawin ulit itong isang papel. Next is kitchen waste. Marami sa kitchen waste yung pwedeng masunog. Tulad ng pinagsuputan ng biniling ano. Next is yard cuttings. Ano ang yard cuttings? For example, ito yung mga kahoy na pinagputulan sa isang furniture shop. At pwede mo rin siyang gamitin sa iba pang bagay at pwede rin siyang masunog or ma-decompose. Next is non-biodegradable. Non-biodegradable is an object that are not capable of being broken down by the action of living organisms. Ano nga ba ang non-biodegradable? Ito yung kung saan mo siya tinapon, nandun lang siya at hindi siya madedecompose ng mas mabilis. Mahirap itong madecompose or nanatili ito at nagiging sanhi ito ng pagbaha. Tulad ng plastic or yung mga styrofoam na kapag na-stuck siya sa daanan ng tubig or sa kanal, sa irrigation or kahit sa pamang form of water, maaari siyang makadulot ng pagbaha dahil nakakabara siya sa daluyan ng ating tubig. For example, plastics, styrofoam, glass, and cans. Alam naman natin lahat ito hindi kayang sunugin. Kayang sunugin yung plastic at styrofoam. Pero yung glass and cans, hindi siya kayang sunugin. Pero yung plastic and styrofoam, hindi siya madedecompose kung hindi mo siya susunugin. Next is hazardous waste. Simply defined as hazardous waste is a waste with properties that can make it dangerous or capable of having a human or harmful effect on human health or the environment. Ano nga ba ang hazardous waste? Ang hazardous waste is yung mga basura na tulad ng gamit na battery, yung mga chemicals or yung gas, yung basta naglalaman siya ng isang chemical, dapat siyang idaan sa proper waste management. Bakit? Dahil ito ang pinakadelikado sa lahat ng klase ng basura. At dahil pwede siyang makasakit or makaharm sa environment at sa ating kapakanan, kaya mas importanteng matutunan natin proper waste management para dito. For example of this is chemicals, used batteries, expired medicines. Pagdating sa chemicals, ito yung mga ginagamit sa pag-experiment or kahit di pag-experiment, basta chemicals. Dapat ito ay nakasinop or nakatago kung hindi na ginagamit para hindi ito magalaw o mapaglaruan ng mga bata. Next is used batteries. Kung mayroon kang pinagamitan or lumang baterya na hindi mo na ginagamit, itapon mo siya kung saan siya nararapat na itapon para hindi na rin mapaglaruan ng mga bata at makasakit pa. Next is expired medicines. Always check your expiration dates in terms of medicines para maiwasan natin yung pagkalason ng magtitake nito. Next is utilizing school and community health resources. Ano nga ba ang utilizing school and community health resources? Kailangan dito mas magamit or mas ma-utilize pa natin yung mga facilities ng school natin or yung mga facilities sa barangay natin. Unang-una is health facilities. Health facilities are places that provide health care. They include hospitals, clinics, outpatient care, and specialized care centers such as birthing centers and psychiatric care centers. Alam naman natin ng health facilities is ang mga pasilidad or mga buildings na tumutulong sa atin upang tayo ay magamot. Kung meron tayong sakit o kaya tayo ay nadisgrasya sa isang aksidente, car accident, motor accident, nandiyan yung health facilities para tulungan tayo. At mahalaga ito dahil dito maraming natutulungan ng health facilities. Pagdating sa mga buntis, mas mahalaga sa isang community na mayroong health facilities. Lalo na pag may mga ganitong sitwasyon at hindi na kailangan bumiyahe ng matagal ng buntis para pamanganak. Next is school clinic. A place within the school campus wherein primary care is rendered to a sick patient. First aid and initial nursing assessments are given during emergent situation. School clinic. Bakit nga ito? How is this important? Importante ito kung sa eskwelahan natin para kung may mangyari mang disgrasya or aksidente sa schools, maagapan natin yung naging biktima or mabibigyan natin siya ng first aid na kailangan niya. For example, sa school nyo nagkaroon kayo ng sunog at merong estudyante na napaso or na disgrasya, maaari siyang applyan ng first aid upang maibsan yung magiging resulta ng disgrasya sa kanya. Next is barangay health stations. A barangay health center is a community-based and the goal is to offer first aid, maternal child health care, communicable diseases, and other basic health services to all the constituents of the barangay. Barangay health station. Ito yung parang pinaka-barangay clinic natin sa ating barangay na maaasahan natin pagdating sa mga ganitong bagay or sa mga sitwasyon na hindi natin inaasahan na mangyayari or mga disgrasya na pwedeng mangyari. Andiyan yung barangay health station para tulungan tayo kung sakaling magkaroon tayo ng disgrasya or merong panganganak, kailangan dalhin sa ospital at kailangan tumawag ng ambulance. Andyan sila para gumabay sa mga constituents nila. Importante ito dahil kung wala ito, mahirapan ang isang barangay pagdating sa mga ganitong sitwasyon.
Good day everyone, I am John Kenneth Vicente from BPED 3D. So this is the continuation of the report of health curriculum in grade 6. Content number 2. Proper waste management. As we all know, proper waste of management can be done applying by the 3 R's. 3 R's means reduce, reuse, and recycled. As we all know, these 3 R's ay napagkahalaga sa isang bata at kailangan din nilang matutunan ito para mas maganda ang kalalabasan ng kanilang performance. Under the proper waste management, we have 3. First is waste reduction. Waste reduction is a practice of preventing waste by recycling or eliminating the amount of materials initially used. Ito yung mga nare-reuse pa yung mga gamit na kaya pang i-edit or kaya pang ayusin ng isang students or ng parents or ng kung sino man. So, next is waste storage. The word is storage. Alam naman natin na ang storage ay pinagsasama or something na nandoon, pinagko-combine or something like that. Waste storage or separation. Separation, kailangan din natin may separate yung mga non-biodegradable and biodegradable, yung nabubulok at hindi nabubulok in terms na magandang way. Next is waste of disposal. And also, kailangan din malaman ng mga students or ng learners mo ang waste of disposal. Under na our examples ng waste of disposal is recycling, animal feed, biological reprocessing, incineration, and landfill. So sa under naman ng content standards, at the end of the learners understanding the importance of keeping the schools and community environments healthy. Why? Kailangan talaga malaman at maintindihan at makuha yung mga important details at maitabi nila sa kanilang sarili para pag naka-encounter sila sa schools or sa community environments, alam na nila kung ano yung mga gagawin nila at alam na rin nila kung paano nila sosolusyonan yung mga bagay na yun. So next is performance standard. Performance standard, at the end of the discussion, their learners should demonstrate practices for building and maintaining healthy school and community environments. Why? Kasi pag hindi maganda yung pagkakaturo mo as a teacher, as a proctor or facilitator, walang magiging na knowledge yung students mo. So mas magandang kailangan mo maganda yung way ng communication sa students mo and maganda din yung pagkaka-delivered mo ng mga message para at the end of the discussion, alam nila kung paano nila i-demonstrate practices, yung mga buildings and maintaining healthy schools and community environments para doon papasok yung performance standards ng isang bata kung may mga natutunan ba sila sa mga pinagsasabi natin. Why? Bakit? Kasi mas magandang malaman din ng bata kung may talagang natutunan siya sa ating mga sinasabi. At hindi na pwede siyang magtanong kasi nga alam na nila yun. So, next is learning competencies. Sa learning competencies, I mean 4, or should I say 6, 7, 8, 9. 6. At the end of the discussion, the learner should be describe proper ways of disposal. Why? Siyempre, alam naman na natin na mas maganda yung pagtuturo at mas maganda yung communication mo sa students mo ay malalaman ka agad at maiintindihan ng students mo yun. So sa students, kailangan niya kagad na describe yung mga proper ways of disposal para mas makita doon yung at papasok doon yung performance standards ng isang bata. Kung maganda ba yung pagkakabigay or pagkakaturo mo doon sa isang klase. So yung code doon is H6 CMH 1LF and 6. Number 7. At the end of the discussion, the learners should be identify things that can be recycled in the schools and in the community. Why? Kasi pinaliwanag mo na yung proper waste management as a grade 6 students doon. Pinaliwanag mo na sa kanila yun. So basically, alam na nila kung paano nila ma-identifies and ma-recycle yung mga bagay na patapon na at yung mga bagay na papatapon, na malapit na ipatapon. So basically, bilang grade 6 students, alam na nila kung paano mag-recycle ng mga bagay sa schools, environments, and kanilang bahay. So ang code doon ay H6CM7 11G and 7. So number 8. At the end of the discussion, the learner should be practice proper waste management at the home and schools and in the community. Yung kaninang pang sinasabi na kailangan na kagad ma-practice proper ng mga estudyante or grade 6 students kung paano mag-segregate, mag-separation, and mag-storage ng mga bagay or mga gamit na patapin na in schools and community and in home. So ang code doon ay H6CM 11G and 8. And the last but not the least, number 9. At the end of the discussion, the learners should be advocates environmental protection through proper ways of management. Bilang grade 6 students, kailangan din nilang i-advocate sa mga environmental protection through proper ways of management. Doon na papasok yung pagiging isang makabayan, makabansa, or something like that. Doon na agad dumapasok yun at makalikasan nila. Bakit? Kasi nag-advocates na sila ng mga environmental protection through proper ways of management. Naayon niya yun sa ating kapaligiran. Na ang code nun ay H6CM 11G and 9. Grade 6, third grading in health curriculum. So, first is content. Sa content is may A or nag-isa. It is a disease and disorder caused by poor environmental health. Sa A na yun is may kalakip na 4 or 4 topics. First is respiratory disease. Second is skin disease. Third is gastrointestinal disease. And 4 is neurological impairment or lead and memory poisoning. So, respiratory disease, it is the infection caused by smoking, tobacco, and etc. Yung mga examples ito is pulmonary fibrosis, pneumonia, and lung cancer. Sa respiratory disease, kailangan dito ma-elaborate lahat ng mga cause, damage, and effects nun. And also, kailangan din maipaliwanag nun ng teachers as well. Next is skin disease. So, skin disease, ito yung mga skin problems or allergies, pwedeng tawaging allergies in other words. Tapos, ito yung mga masasakit, mahahapde sa mga katawan. Ang mga examples ito is eczema, cold sores, or dry skins. Next is gastrointestinal disease. Doon yung pumapasok yung examples dun is chronic diarrhea, lactose intolerance. And last is neurological impairment. It's damage for nervous system. Ito yung mga examples ng epilepsy. Next is ang content standard. The learner should demonstrate understanding of the health implication of poor environment sanitation. Kailangan din na, as a grade 6, kailangan nilang ma-demonstrate yung pagkakaintindi nila sa mismong health implication ng poor environmental sanitation. Dahil pag hindi nila discuss yon, hindi nila na gets or naintindihan yung mismo tinapik ng teachers. And besides, kailangan din maipaliwanag ng teachers yung pinaka mismong health implication of poor environmental health or health sanitation. Next is performance standards. So the performance standards is the learners are consistently practices ways to maintain a healthy environment. Why? Bilang grade 6 students, kailangan din nilang i-maintain yun para maging malinis sila, malinis yung kapaligiran, and malinis yung kalikasan, bahay nila, and schools as well. Besides, dun makikita kung may natutunan ba talaga at may mai-apply ba nila yung pinag-aralan nila na yon with the help of a teacher in reality life. So, learning competencies. Sa learning competencies ay may dalawa lamang. First is describes disease and disorders caused by poor environmental sanitation. So, kailangan ng students na ma-describe yung mga disease and disorders na pwedeng makuha sa environmental health, na pwede din pumasok ng respiratory disease, skin disease, gastrointestinal disease, and neurological impairment. So, yung code nun is H6, EH, 11L, A, and 1. So, number 2 explains our poor environmental sanitation can negatively impact the health of an individual. So, as grade 6 students, kailangan din nila ma-explains nila kung paano yung mga environmental sanitations na nag-negative impact sa buhay or sa isang health ng bawat isa. Besides, kailangan din nilang matutunan yon para alam nila kung paano i-gawin in reality pag naka-encounter sila sa buhay nila. And besides, dun papasok or dun lalabas kung ano yung performance standards na may apply nila at kung ano yung mga learning na natutunan nila sa isang discussion with the help of teacher. So, pumapasok dun yung code as H6EH 111B and 2. That's it.
So, for the environmental sanitation, on the letter B, first is clean water, access to portable water, and making water safer. Means that students will have an access to free and safe water. Second is clear air, prevention of air pollution, tobacco control, anti-smoke bleaching drives. So, in this part, the students will be having an information on how important the clean air is. So, also students or the learners will be given another informations on how they will prevent air pollution and also tobacco control or smoking control. And also will be having an anti-smoke bleaching drives. That means the reducing the use of vehicles. So third is control of noise pollution, means reducing the use of environmental materials that would cause disturbing and unwanted sounds that may affect humans. Next is control of pests and rodents. The learners will be giving information on how to prevent the reproduction and to be able to control the current numbers of pests and rodents or rats living in our society. So, this learner demonstrates understanding of the health implications of poor environmental situation. So, the learner consistently practices ways to maintain a healthy environment. Next one is the importance of consumer health. First is wise and informed decision in purchasing products or availing services. So, students has to make health decisions at some time or another. Being a wise health consumer can help you ask the right questions and medicines at your doctor's appointment. Second is protection from fraud and malpractice. This explains that the learners
should know how to protect themselves from fraud or fake people and malpractice. For an example on health issues, students should know the difference between the real doctor and the fake doctor to prevent and avoid wrong consultations. And third one is the ability to differentiate valid health information, myths, and misconceptions. So, meaning students should have the ability to understand the difference of a doctor and a folk healer, because this belief in this folk healers carries dooms. Instead of taking real medicines, you are doing rituals that are not needed when you are, for example, in a cancer stage. That is one of the things that students should consider.
Good day everyone, I'm Lester Valentino from Repeat 3D. Now I will going to discuss Health Curriculum Guide under Grade 6. The content in letter B, which is Components of Consumer Health. Number 1, Health Information. Sources includes books, print ads, radio, television, internet. Number 2, Health Products. Pharmaceutical, cleaning agent, food, personal care product. Number 3, Health Services. Health professionals, health units, healthcare plans and program. Content standards. In this column, the learners will be able to get some knowledge about the importance of the different components of consumer health. Dito papasok yung kung paano nila gagamitin yung sources like books, journals, articles, and other learning or instructional materials for them to know the importance and the components. Performance standards. Dito naman is you will perform through reporting about the health information, mga health products at services na pwede at pasok sa components of consumer health. Sa ganitong bagay, they can adapt and memorize the components or kung paano ba nila i-apply yung mga possible na pwedeng gamitin for health components, able to know the information about it. Learning competency. The learners will learn about the components as I've explained before. They will able to adapt the information at yung advantage na malalaman or matutunan ng mga different components. The content in letter C. Medicine as health products. Types and uses. Over-the-counter such as antacid, analgesic, antipyretic, antidiarrheal, laxative, and decongestant. Number 2, prescription such as antibiotic, antidepressant, and the learners will understand and define about medicine, kung paano nila malalaman yung iba't ibang kinds ng medicine na pwedeng maka-help sa kanila in case there was an incident or unexpected emergency na need mag-intake ng anong uri ng meds for the ill. Then ma-identify nila kung paano ito inumin na hindi na nila kailangan ng kung sino mang professional sa medicine. At least may knowledge sila about doon. Performance standards naman is yung learner ay pwedeng i-demonstrate at i-report about sa mga kinds ng medicine, pwedeng PowerPoint or flashcard ng picture with its prescription, kung para saan ba yung gamot na to and paano siya i-take. Learning competency. The learners will understand and learn about the different types of medicine. At yung uses, they would easily know about the medicine kahit basic knowledge lang about the meds, basta may natutunan sila about the medicine and its uses.
And this is the 4th grading quarter content in grade 6 health education curriculum. It includes evaluating health products. In number 1, you need to ask a question. What is the motive of advertising? It creates awareness of brands, products, services, and ideas. And also, it announces new product and programs. Number 2 is identify the propaganda techniques used. If testimonial is credible figure to influence the target audience. Next is the bandwagon. It creates a sense of isolation and triggers FOMO in specific people. Next is fear, to scare people to taking a desired action. Next, we have plain folks. Seeing seemingly regular people endorse a product or service, prime prospects. Next, the glittering generality. Employs loaded words and strong slogans. And also, it includes other techniques like false image, slogan, scientific novelty, humor, and others. Next one is the read packaging level. Why it is needed? Because it helps you to make informed food choices. And the learning competency in this content is identify the common propaganda techniques used in advertising and analyze packaging and labels of health products. And the next content is use the modified decide model in the selection and purchase of health products. Decide model, it means determine the essential product to purchase. Number 2, explore the alternatives. C. Consider the consequences of each option. I. Identify the factor that you considered important. D is decide what you buy. And E is evaluate your decision. And the learning competency is practice good decision making skill in the selection of health products. And the last is protection from fraudulent health products. A health product is fraudulent if it's promoted to treat a disease or condition. The first protection is awareness and vigilance. And the second is know how and where to seek help, like contacting where you purchase the product or in your healthcare professional. And the learning competency in this content are discuss the way to protect oneself from fraudulent health products. And the content standard is the learner understand the concept and principle of selecting and using consumer health products. And the performance standard is the learner consistently demonstrate critical thinking skills in the selection of health product. And that's all in grade 6 health education curriculum. Thank you.